Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
Hi, I'm Dr. Gerstner, and you are?
Gene.
Gene. I hear you have a temporomandibular disorder. Can you tell me what your chief complaint would be with respect to that?
Well, this side of my face hurts, all up on my ear and my eye, and it started with I heard this terrible cracking in my jaw. And
How many years ago did that happen?
well, no, that was just about 3 months ago,
3 months
and then
ago.
I made the appointment and came in here today.
Did you have anything that happened to your jaw that caused this to occur?
Well, I was eating some hard, crusty bread, and that's when I first noticed that cracking sound. And then after that, it was painful.
Did you
at the
see a
point.
doctor about it?
No, I'm here now to
This
see
is
the
the first time
dentist.
that you've seen anybody about this.
Well, it just happened.
Okay. What are your current symptoms?
It's sore. It's just this constant, dull, sore, achy pain.
And on a scale of 1 to 10, how bad would you say it is?
Well, at the time it happened, it was about a 8, but now it's a constant 6 all the time. I always
Okay.
notice it.
Okay. Does anything make your symptoms worse?
Yawning, chewing hard things,
Anything
sleeping,
make it better?
not yawning, not eating,
Okay.
not sleeping.
So now that you're here, what are your expectations? What do you think we can do for you?
Well, I want to find out what it is and see if there's any type of something, exercises I can do, or I don't know.
Okay.
I don't know.
Medical history, have you had any allergies or other injuries?
Which ones? Allergies? or-
Allergies?
Allergies to,
Anything? Foods, pets,
no.
injuries?
Oh, allergic to penicillin.
Penicillin, okay. Injuries to your head or any part of your body, motor vehicle accident or anything like that?
Yes, in the past.
What were those and how long ago?
Well, I had 2 head injuries, one when I was a child and another when I was an adult, and it was the same type of head injury, and both of them resulted in my jaw being out of whack.
Okay. Any other illnesses or surgeries
To my face.
to any part of your body? Just general medical conditions.
Surgeries, I had a appendectomy.
Okay. How have you seen a doctor recently for physical or
No.
had any other systems reviewed? Do you have any cardiovascular disease in your family?
No.
Or genital urinary infections or gastrointestinal problems?
No.
Immune or skin problems or blood problems?
Immune problems. I have thyroid,
Thyroid condition? Okay. And are you taking any medications for that?
synthroid.
Synthroid, okay. Any psychosocial issues that we need to be aware of with respect to your jaw? Any psychological or educational or marriage or employment problems associated with this condition that you might?
With my jaw?
Mhm.
I guess I don't know what you mean.
Okay, sometimes we see that stress or changes in life can cause these kind of problems or be associated with them. So I was just wondering if there's anything that you might want to, that you think might be contributing to this problem that way.
Yes, for some reason, when I sleep, somehow my arms end up over my head, clenching like that.
So do you sleep on your back side?
I
or
sleep on my back
on your back?
with my arms over my head, and then they get tighter, 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 and I think that's crunching everything.
Okay. Well, I need to do an exam now. And have you had anybody ever palpate your muscles on your face? I just want to press on your face and see if I can find out where your pain is. Is this sore?
On this side,
A little bit sore? On a scale of 1 to 10, how bad would you say it is?
6.
Okay. And now?
7.
Okay. And again?
Nothing.
Nothing?
Now it hurts on this side.
Okay. Okay.
That's a 7.
Okay.
Nothing.
Okay.
Nothing.
Okay, let me have you open your jaw as wide as you can and close, and open and close. I'm going to have you slide your jaw forward as far as you can and side to side. Okay, and open again. I'm going to listen. Open, okay.
Did you
Open
hear
again.
the, did you hear the pop?
I heard popping. How long have you had popping?
Just since when that incident happened 3 months ago.
Okay, and open again. Okay, well, you definitely have some joint conditions, and it looks like you're pretty sore on that side. And I think if we go with a conservative home care program, which means watch the foods you eat, eat soft foods.
Well, I do that.
Okay, and moist heat packs or ice packs. I'd try those 3 or 4 times a day.
Well, I've been doing that too.
Okay, good. And we'll probably recommend a bite splint, and we can have a bite splint and have you wear a bite splint on a nightly basis. And do that for about 6 weeks, and we'll determine whether your symptoms get better, and if not, then we'll try a second course of treatment beyond that. I think that should help. So,
Well, what kind of bite splint?
well, the bite splint is a splint. It's made out of hard acrylic, and you wear it on your upper teeth typically while you sleep. And what it does is it allows the lower jaw to relax, and that relaxation will take some of the stress and tension out of the muscles. It takes about 6 weeks for it to kick in, and when it finally kicks in, you should be able to see some improvement.
Well, I had one before.
You have had a splint before?
Oh, yeah.
How often did you wear it?
Well, I wore it every night, and it didn't relax my jaw. It
Oh, do you
made
remember
me
what
work
kind of
it
splint
even.
it was?
It was plastic
It was
acrylic,
a plastic splint.
fit over the top teeth, just like you said.
Okay, and you wore it every night
Mm-hmm.
for how long?
Years.
For years.
And I would end up somehow in the middle of the night taking it out without knowing it. And it still seemed not to loosen my jaw because for some reason I can't get over my arms going up like that when I sleep. I can't seem to be able to control that.
Well, so who made this splint for you? It was a previous dentist?
Mm-hmm.
Okay, well, this one's probably going to be a different splint because we've had some research done, and we can make, I think, a better splint for you. And if we can give that a shot, knowing that we can stabilize and have a very calibrated splint, I think that we can at least determine whether the splint will help. And I think that's a good place to start. And if we can see if that'll help, then we know where we can go from there, because then we can employ some other physical medicine techniques that might help above and beyond the splint. But I think we need to start with the splint first.
Well, what would be the next step?
The next step would be to use physical therapy and maybe to employ more rigorous splint wearing during the day if necessary. So I think if we can start there, and then we'll see after about 6 weeks, we should be able to see if you're getting better, and I'm pretty sure that you'll get better. Okay. So it was nice to meet you, and I'll get on that right away.
Okay.
Thank you.
You've been listening to a production of the University of Michigan School of Dentistry. For more information about Michigan dentistry, visit us on the web at www.dent.umich.edu.